Bismillahirrahmanirrahim. Hello folks. So here we have another question which stated that a 24-year-old woman come to the office due to postcoital bleeding for the past week. She has had three new male sexual partners over the last 6 months and used condom inconsistently. The patient has mild persistent asthma for which she take low dose inhaled glucocorticoids. She is also taking oral contraceptive and her last menstrual period was 3 weeks ago. White signs are normal. Pelvic examination show a thin male odorous vaginal discharge and erythema of the vulva and vaginal mucosa. The cervix is erythematous and has multiple mucolar rashes that easily bleed when probed with a cotton swab. Wet mount microscopy of the discharge show motile ovoid shaped organism. Urine pregnancy test is negative. Which of the following is the most appropriate treatment for this patient? So the choice A acyclovir, choice B boric acid, choice C clindamycin, choice D doxycycline, choice E fluconazole, choice F metronidazole, choice G penicillin G benzathine. So first of all, as I told you that there is always a hint in the question. So for the diagnosis of this question, first of all we have to search for the hint. So the first hint is postcoital bleeding. This is the first hint. The second hint is on the pelvic examination. It show a thin male odorous vaginal discharge. The third hint is erythema of the vulva and vaginal mucosa. This means that the inflammation of the vulva and the vaginal mucosa. And the fourth hint is on wet microscopy of the discharge, which show the motile ovoid shaped organism. So this is the four hint. The first, postcoital bleeding. The second, on examination, pelvic examination, there is a thin male odorous vaginal discharge. Number third hint, erythema of the vulva and vaginal mucosa. Number four hint on microscopy, which show the motile ovoid shaped organism. So based on these four hints, as we already know that what is the diagnosis of this question. So what is the diagnosis of this question? The diagnosis of this question is Trichomonas vaginalis. Trichomonas vaginalis. So this is the diagnosis of question. Sorry. So this is the diagnosis of this question. Diagnosis Trichomonas vaginalis. As I already discussed in the previous question, there are three differential diagnoses of the vaginal infection. So let revise briefly here. So first of all, the bacterial vaginosis, as already I solved the question on bacterial vaginosis in the previous question. So on bacterial vaginosis, on pelvic examination, there will be thin of white discharge with fishy odor, and there will be no inflammation. This is the differential between the bacterial vaginosis and trichomonas. No inflammation in the bacterial vaginosis, plus the pH will be more than 4.5, and there will be occlusal. On web test, there will be positive web test, and the treatment option for the bacterial vaginosis is also same like trichomonas. So the treatment option for bacterial vaginosis is metronidazole. This the the second number differential diagnosis is candida vaginitis. So for the candida vaginitis, first we will check that there will be the thick cottage cheese discharge, and there will be also a vaginal inflammation. On candida vaginitis, the pH will be normal, so the pH will be 3.8 to 4.5. This will be the normal pH in candida vaginitis. Plus there will, on microscope, there will be pseudo hyphae, and the treatment option for candida vaginitis is fluconazole. Let's come to the our diagnosis, trichomonas vaginalis. So here the choice F is the correct one. Choice F is the correct one. Metronidazole we can give to the patient with trichomonas vaginalis. So first of all, on trichomonas vaginalis, there will be thin yellow green male odorous fruity discharge with vaginal inflammation. Here is the vaginal inflammation, erythema. Here is the vaginal inflammation, include the erythema of the vulva and vaginal mucosa. Plus the pH will be the pH will be more than 4.5, and there will be motile trichomonas. So this is the motile ovoid shaped organism, as I told you, and the treatment option for this is metronidazole. So for metronidazole, Metronidazole is the treatment option for the trichomonas vaginalis, and metronidazole we have also to give metronidazole to the patient's sexual partner, because as already we noted that trichomonas vaginalis is asymptomatic in some cases, but we have to give the metronidazole to the sexual partner, and we have to explain the patient that you have to keep in mind that you have to not sex with your sexual partner for the coming a week or 2 week, because there is a chance of reinfection. So here the correct option is choice F, metronidazole. So now come to the incorrect one. Why the choice is incorrect? Acyclovir. Choice is incorrect because acyclovir treats herpes simplex virus, which causes painful genital ulcer or ulceration. This is the acyclovir. The choice come to the choice B and choice C together. Why the choice B and choice C are incorrect? Choice B is boric acid, choice C clindamycin. So boric acid and clindamycin may be used in treatment of recurrent bacterial vaginitis. The choice D stated doxycycline. Why? Because doxycycline may be used to treat chlamydia trachomatis cervicitis. The choice E, fluconazole. Choice E, fluconazole. Fluconazole is used in treatment of candida vulvovaginitis. The choice G, penicillin G benzathine, is used to treat syphilis, which present with lesion like chancre or condyloma lata. So let me revise again. The choice F, the diagnosis of this question is trichomonas vaginitis, and the trichomonas vaginitis. There on the pelvic examination, there will be a thin melodious vaginal discharge, and there will be inflammation of the vulva and vaginal mucosa. Plus, there will be a postcoital bleeding, and on microscopy, there will be a motile ovoid-shaped organism. So, we will give this patient metronidazole and explain to her that she will not meet with her sexual partner in the coming week or 2